Assalamu alaikum. I hope so. You're doing fine. I'm Dr. Muhammad Ali Rabani, and today we're going to talk about the extensor retinaculum, its attachments and structures passing around it. So, there are two extensor retinacula. The one that is in the anterior compartment of leg, this is superior extensor retinaculum, and the one that is below, this is the inferior extensor retinaculum, that is in the dorsum of the foot. This is attached, superior one is attached medially to the anterior surface of tibia, anterior border of tibia, and laterally is attached to the anterior border of fibula in the triangular area above the triangular area of the malleolus. Inferior retinaculum consists of a stem. This is the stem that is arising from this lateral margin of the calcaneum bone, supralateral surface of the calcaneum bone, and it is dividing into two bands. The upper band goes on to getting attached into the late medial malleolus of tibia, and this lower band it goes and wraps around the foot and goes to the undersurface, gets attached to the plantar aponeurosis, thus shifting it to the calcaneum indirectly. When we look structures that are passing beneath or through it, uh, let's go from medial to lateral. I'm not going into much detail about which structures are passing through it underneath it. Let's go from medial to lateral. From superior retinaculum, there is tibialis anterior, then there is uh, anterior tibial artery, then deep peroneal nerve, then extensor digitorum, extensor hallucis tendon, then extensor digitorum tendus, and peroneus longus tendon, peroneus tertius tendon. Let me repeat. If we talk about superior one, there is tibialis anterior, then this artery, that is anterior tibial artery, then deep peroneal nerve, then extensor hallucis longus, then extensor digitorum longus, and peroneus tertius muscle. If you look beneath this one, the lower one, the inferior extensor retinaculum, the arrangement is a little different. Then there is tibialis anterior, then extensor hallucis longus, then rather than anterior tibial, we'll say dorsal pedis artery, then there is deep peroneal nerve, then there is extensor digitorum longus, and then there is peroneus longus tendon. So apart, these two structures are switched and the name of the artery is changed here. If you go into the detail, there is a little theory about some structures are passing underneath it, like some structures are passing through it, tibialis anterior is a good example, that is passing through a tunnel in this. It is passing through this band and beneath this band, so you can read it all. I am not going to overcomplicate the lecture right here. The structures that are passing superficial to it, from medial to lateral. On the medial aspect, the structures that are passing superficial to it are these two, that is the great saphenous vein and the saphenous nerve. On the anterior surface, these are these two nerves. These are the medial and lateral branches of the superficial peroneal nerve, and these are basically the small superficial veins of the dorsum of the foot that are going to the drain into great saphenous vein. These structures, same structures are shown here. The upper part is shown here, where it's shown great saphenous and saphenous nerve shown here, medial and lateral branches of common peroneal, and the tendons passing through it, and beneath it, tendon passing through the retinaculum, and artery with vena comitenta and veins passing beneath it. This is the picture from Snell's Atlas. Thank you so much. If you have any questions, suggestion, and feedback, please let me know. And that's it. That's what we wanted to discuss. The next lecture will be about, the next video will be about flexor retinaculum.